The process of swallowing involves the movement of substances from the mouth through the pharynx and esophagus to the stomach. Swallowing has three main stages: the oral, pharyngeal, and esophageal phases. The oral stage is an active phase with two steps. The first step is the preparation of food bolus. For liquids, the bolus is first sealed in the oral cavity by the tongue anteriorly and hard palate posteriorly. Meanwhile, for solids, it undergoes processing via mastication and manipulation, and the bolus is not sealed in the oral cavity. Next, tongue compresses bolus against the palate and posterior pharynx with tongue elevation. The hyoid elevates and bolus is propelled toward the vallecula. The bolus is held in the oropharynx until the pharyngeal phase initiates. The pharyngeal phase is an involuntary, irreversible and reflexive phase of swallowing. This stage serves two primary purposes. Firstly, to direct food into the esophagus, and secondly, to protect the airway from aspiration. It is a wave of coordinated stimuli propelling the food bolus to the upper esophageal sphincter. Firstly, the tensor pallottini and levator pallottini contracts, elevating the soft palate to seal the nasopharynx. Then the lateral cricoarytenoids adduct the cords, as well as oblique and transverse arytenoid muscles contracts to bring the arytenoid cartilage together, resulting in glottic closure. The suprahyoid muscles contract to elevate the pharynx and pulled anteriorly, which helps to open the pharyngeal esophageal transition. Finally, the bolus moves inferiorly by a peristaltic-like contraction of the superior, middle, and inferior pharyngeal constrictor muscles in a top-to-bottom fashion. Lastly, the food bolus descending through the upper esophageal sphincter into the esophagus. This occurs by contraction of the thyrohyoid to move the larynx and hyoid superiorly and anteriorly. Secondly, a manometric relaxation of the cricopharyngeus, and a pressure-dependent distension by the bolus. Lastly is the esophageal phase. This phase is an involuntary autonomous process. The bolus is propagated inferiorly by a wave of peristalsis within the esophagus into the stomach. Thank you for listening and see you next time.